by the Activist Coalition on TB Asia Pacific, hosted by APCASO, and the Africa Coalition on Tuberculosis, or ACT Africa, with support from the Global Fund. So this Lessons 10 is also co-sponsored by the Regional Learning Hub of Anglophone Africa and the Asia Pacific Learning Hub, both supported by the Global Fund. So before we proceed with the meat of the discussion, I'd just like to run the different webinar guidelines that we have been following in the past few sessions. So first, as you can see right now, the session is being recorded so that we can view it later, especially for those who are not able to join. And then we also invite our participants to set your Zoom name using the following format. So you can put your name, you can add your pronouns if you're comfortable, and then also your organization. And then just so we can hear the speakers clearly, we invite everyone to mute their microphone when not speaking and also turn on your camera so that we can have a more interactive session, especially when the speakers are delivering their presentations. And we also invite everyone to use emojis and use the raise hands function, especially during the Q&A session. And as you can see now, the session is also translated in the following languages. We have English, French, Khmer, and Bahasa. And as always, let's make sure that we contribute in creating a safer space for the discussions. And we invite everyone to ask questions, learn from each other, as well as share their insights. So please feel free at any point to utilize the Q&A function as well as the comment section if you have insights or if you have questions. And then we can answer them or ask them to our panelists during the Q&A session. So for the interpretation, just to make sure that everyone is on the right channel. So if you prefer to listen in on a specific language, so you can just look at the interpretation icon at the bottom part of your Zoom interface, and then select the language that you're most comfortable in. So again, we have translations in English, French, Bahasa, and Khmer currently. So now, before we go to our discussion, I'd like to start with a icebreaker. So if you can go to this link, www.kahoot.it, and then enter the following PIN. So that's 182127. You can also join in by scanning this QR code that you see on the screen. And it should lead you to this interface. So let me just switch to that interface. Okay, so again, that's www.kahoot.it. So once you enter that, it should lead you to this interface or website. All right, let me try that again. So I just want to confirm if you can see uh, my screen right now. So I think it's going to enter a new PIN.
Yeah, hello, we can see your screen.
Okay, thank you for confirming that. So now I invite everyone to join the kahoot.it. So again, it's a new PIN, so that's 524239. So I see people entering the link already. So let's just wait for some more participants to join in, and then we'll be starting. All right. Thank you also for those who are introducing themselves in the chat. So please feel free to introduce your name and your organization in the chat, and also join us in this Kahoot activity. So the game pin is 524239. So let me know if you're having challenges entering the Kahoot. Okay, let's wait for some more participants. Thank you, Jeff, for placing the Kahoot link on the chat. Okay. So more participants are coming in. So you can also use anonymous names. So if you're shy, it's fine. So let's wait for probably 3 more. Can we reach at least 10 participants and then we'll start the Kahoot icebreaker. We're waiting for 1 more and then we'll start. Okay. So last call for those who want to join the Kahoot game. Okay. I think probably we can start now. So again, the idea here is that we have series of questions and then you just select the right answer. So the sooner that you answer the correct answer, okay. So again, the question is, it's an integrated unifying approach that aims to sustainably balance and optimize the health of people, animals, and ecosystems. So if you were in the previous lessons, it focused on this topic. Okay, the correct answer is One Health. So I think 6 got the correct answer. All right, that's good. So we have Daisy on the top, followed by PN and then AP. Okay, next question. So all of the following are aligned with the necessary shifts in global health policy, except A, focus on disease control. Well, that's the red one. The blue one is ecocentric approach, yellow, health as an investment, and then strengthening health systems. Okay, 8 already answered. Okay, so the question here is, which are aligned with the shifts that we're seeing now in global health policy, except, so we're looking for the wrong answer. So, of course, we want an ecocentric approach, meaning it actually considers the environment. We want, of course, strengthening of health systems, because that's the foundation. And then we also see health as an investment, no, not a cost. So now, what one of the things that we're not that is not aligned with the global health policy is merely focusing on disease control, because we want to be more proactive in terms of addressing the different pathogens, no, that we're seeing. All right. So that was quite a challenging question, I guess. So we now have a new leader for the scoreboard. So next question, which agency is not part of the quadripartite committee of practice on One Health governance? So is it red, WOAH, blue, WHO, yellow, UNFPA, or green, FAO? So these are the different agencies who bonded together to talk about One Health, which is not included. Okay. So, of course, we have the World Organization for Animal Health, we have the World Health Organization, and we have the agency focused on food and agriculture. What is not included is UNFPA. So I think the other one is UNEP. All right. So only 2 got the correct answer. Okay, so we now have AP and Shy Girl at the top. Okay, next question. Which principle emphasizes fair inclusion and engagement of all communities within the One Health approach? So red, economic development focus, blue, equity and social political parity, green, selective inclusion of experts only, and then yellow is centralized decision making. Okay, we only have 3 who answered now. 6, 7, 8. Okay. The correct answer is equity and social political parity, because it talks about inclusion and engagement of communities. Right? So 4 got the correct answer. So we don't advocate for selective inclusion of experts only because we want it to be open, even the committees can participate. And we also don't advocate for centralized decision making. We want it to be spread through the different decision makers. Okay, next question. Well, we have a very dynamic scoreboard. Okay, so in One Health, what is a major barrier to operationalizing multi-sectoral collaboration in zoonotic disease surveillance? So is it red, lack of diagnostic tests for humans? Blue, fragmented health systems and data silos? Green, excessive funding to veterinary services? Or yellow, overlap of responsibilities among environmental agencies? Okay, so most of us got the correct answer. So it's really the fragmented health and data systems between human and animal health that serves as a barrier to push for the multi-sectoral collaboration. Okay, I think this is the second to the last question. So how does the One Health approach address antimicrobial resistance challenges? So is it red, promoting over-the-counter access to antibiotics? Blue, limiting antimicrobial use to humans only? Green, ignoring veterinary practices to focus on human medicine? Or yellow, coordinating surveillance and stewardship programs? Okay, so most of us got the correct answer. It's coordinating surveillance and stewardship program. Okay, last question for the icebreaker. So as you can see, most of the questions that we have for this Kahoot are coming from the previous webinar, right? So core principle of One Health that helps mitigate emerging infectious disease risks associated with land use change. So red, urbanizing all rural areas quickly. Blue, maximizing agricultural expansion at any cost. Green, maintaining ecosystem integrity and biodiversity to reduce spillover risk. And yellow, ignoring wildlife health. Okay, so almost all got the correct answer, maintaining ecosystem integrity and biodiversity. So as much as possible, we want to reduce the spillover and the transmission of zoonotic diseases to human beings. Okay, so let's look at the scoreboard for this icebreaker. So at third place, we have Daisy. And then we have Yo for second place. And then for the champion, we have Hugh Hugh with 3,372 points. All right. So would Hugh Hugh be comfortable in terms of revealing themselves? So who's Hugh Hugh?
I'm gonna speak next.
Oh, okay, so it's Shine. Okay. Congratulations. So now, as your prize, you will be speaking later during our webinar.
Yeah.
So congratulations also to our second and third placers. Okay, let me just go back to our slides. Okay, so just a quick run through of what lessons is. So the idea of lessons is to equip participants, specifically civil society organizations, on knowledge on pandemic preparedness and response through lectures from resource person and knowledge exchange activities with country implementers. So we've been very active in terms of updating the Knowledge Hub website. So you can scan this QR code. So if you want to look at the previous lessons webinars as well as the articles, please feel free to scan the QR code or visit copper.apcaso.org and it will lead you to this website. You can also view the post-webinar articles. So the last one for webinar 9, which focused on One Health and post-pandemic accord, you can view it in the website as well. So you can scan this QR code and it will lead you to the different webinar articles so that you can just read it if if you have limited time to view the videos. And we also have a PPPR guide for communities. So you can also scan this QR code if you're interested to learn about the different approaches to community engagement, understanding the JEEs, SPAR, and the NAPs, and also implement some activities related to community engagement in the PPPR process. And we would also like to promote this compendium of community guides for pandemic preparedness and response. So it's a very comprehensive toolkit of different guides that we civil society organizations can use. So now, before we proceed with our speakers or our country implementers, I'd like to call on our colleague Olive Mumba from the Global Fund to give the opening message and contextualize our discussion for this session. Over to you, Olive.
Thank you so much, RJ, and thanks to ACT AP for coordinating this webinar. Just to say thanks again for preparing for the icebreaker. It's quite interesting and it really reminds us of where we started from. You know, we've had, this is the 10th, is it the 11th, yeah? 10th or 11th lessons, yes. So just to say, appreciations to the two regional networks, that's ACT Africa and ACT Asia Pacific, for all the work that they have been doing in this last almost 1 year now, since we started the implementation of the COPPA, Community Engagement Component. And as we all know, this is being implemented in 8 countries. I will not mention all the 8 countries, but from those 8, today we'll be hearing from 3 of them, from Liberia, from Nigeria, and from Philippines, what they have been doing. Just to take us into, into what the teams have been implementing, I would like to remind us that from COVID, we learned that communities need to engage, especially when it comes to decision-making processes. They need to, their voices, their needs and priorities should be integrated in governance systems. So we carried out a survey sometime in 2023 through, and that's where we identified what could be done. And some of the things that came out were PPR literacy. It was quite clear that PPR literacy was quite low, and and acting as a barrier towards engaging in these decision-making processes. But also communities didn't know where these decision-making processes for PPR are. So from the orientation that we had in last year, we saw a lot of interest. We saw the 2 organizations through their country partners carrying out PPR literacy trainings, developing tools and guidelines, but also developing advocacy strategies, up to the point now that we've seen some of them engaging in national PPR processes at various levels and at, depending on where they saw the need is. So I'm happy that at least we'll be hearing from the 3 countries. And with that, I would not want to take more time, but to appreciate all the work that has been done so far, both at the regional level and also at the country level. And I think what we'll be having is we'll have the presentations, and then if you have comments, please put in the chat. Thank you so much, and back over to you.
Thank you, Olive, for that message. And it's always inspiring to hear how we started as a network, and then now we're focusing on institutionalizing the gains for community engagement. And it's always inspiring to hear, especially from the country implementers who are doing amazing work in their specific countries. So now I'd like to focus already and turn our attention to the different sharers that we will be hearing from today. So first, we have Ms. Shine Catedral from the Action for Health Initiatives from the Philippines. So she is a team leader and advocacy officer at Achieve with over a decade of experience managing the full life cycle of global and local health projects. And her work focuses on critical health issues, including HIV/AIDS, tuberculosis, and health emergencies. Second, we have Mr. Paul Balogun from the Jana Health Foundation. He is a community engagement specialist and a policy advocate. And later on, during his session, we will also be hearing from their public health director, who will highlight the impact and successes of linking the health system with community representatives. And lastly, and definitely not the least, our speaker from Liberia, Mr. Leo Tia from the Youth Network for Positive Change. So for the first speaker, I'd like to turn the floor over to Shine. So over to you, Shine.
Hello, everyone. So, Doc RJ will be sharing my slides, right?
Yeah, let me just shift to that. So let's give Shine a warm round of virtual applause.
So, good day, everyone. As mentioned by Doc RJ, I'm Shine Cathedral. I'm the advocacy officer from Achieve, and Achieve is the country implementer of Copper CE project in the Philippines. So, as you know, Copper CE aims to build CSO and communities' pandemic preparedness response capacity, ensuring that national health emergencies, policies, strategies, and programs integrate health equity, human rights, and gender equality. So, to support this, next slide. The Copper Coalition was created, so this is one of our key results. So a group of 25 civil society organizations working on TB, HIV, public transport groups, women, youth, and other community groups that can play a critical role in responding to health emergencies. So also, we were able to train around 50 of this coalition members on enhancing community capacity for PPR and human rights, and 30 were also trained on advocacy and MNE. So from those 50 trained on community capacity for PPR and human rights, we were able to conduct learning group sessions to around 500 people, constituencies of our Copper Coalition members. So when we trained them, they were able to reach at least 10 of their constituencies. So that's a total of 500. We were also able to develop an advocacy strategy and advocacy roadmap. The 5 areas of main focus of the advocacy strategy of the coalition include sustainability of comprehensive, accessible, and quality healthcare services for all, livelihood security and social protection, such as financial support, aid, gender-based violence, access to quality education for children and young people during pandemics, and lastly, access to accurate, responsive, and relevant information in times of pandemic. So, next slide, please. We also have some results on development of peer education session brochure. We use this brochure for our learning group sessions. That's the one that you can see on the right side of your computer, of your screen. The topics include PPR and community engagement. Also, we were able to develop community materials such as calls to action developed from the coalition's advocacy priorities. So from that, around 50 government agencies, LGUs, INGOs, and networks pledged to commit effective, sustainable, resilient, and people-centered health systems. Also, Achieve has been working on the passing of the TB bill, and as we experience interruptions in TB services during the pandemic, we were able to insert the provision on ensuring continuity of TB services during emergencies. Next slide, please. This is the last slide, but I think these are the more important key results that we are most proud of. We have the Philippines is now integrating our community-led monitoring with health emergencies. So we are proud that our Copper Coalition members have also been part of the Community Advisory Committee of the National CLM. So we have a KII tool that was developed to generate evidence on performance of primary healthcare facilities, focusing on effectiveness and efficiency of services delivery through AAAQ framework. So we have the availability, accessibility, acceptability, and quality, and their level of preparedness for health emergencies. So to validate indicators and tools, the validated indicators and tools were also integrated into the country CLM roadmap. We have also developed sector-specific advocacy plans for health emergencies. So that's the second one. We were able to develop advocacy plans for youth, women, migrants, TB, and HIV affected populations. So this is a strategy for us to sustain coalition engagement by empowering the communities to lead the implementation of these plans, integrating them directly into their existing advocacy efforts. Second to the last, we were able to process the manifesto or plan of action of our Tricycle Operators and Drivers Association, or the TODA. So among the issues raised by the TODA in their manifesto include programs for alternative livelihood in times of transport service limitations and or other income streams towards economic resilience. They also called for fair and timely aid distribution and clear and timely information sharing during any emergencies. Last but not the least, there is an active engagement of coalition members in the NAPS, or the National or the Action Planning for Health Security, with efforts to integrate community and CSO activities to broaden participation. So one key achievement has been our advocacy for CSO involvement in health security plan in the national one, and particularly in the areas such as strengthening international health response, focal point functions, and institutionalization, advancing legal instruments specifically on gender equality, inequity in health emergencies, enhancing risk communication and community engagement, and improving human resources, among others. So that's all from my end. If you have any questions, I think we have time for that later. Thank you.
Yeah, thank you, Shine, for that very brief but also very impactful presentation. And I think what really stood out for me when I was listening to you is that how you were able in the Philippines to conduct demand generation activities by magnifying or mainstreaming human rights and pandemic preparedness and response to improve the health services. But also, I think one of the peculiar things about the Philippines work is the action on social determinants of health, right? So you covered gender, you covered livelihood, and making sure that all of these services are available to people, especially during the time of pandemic. And you were also able to mobilize a multi-sectoral action through your work with local governments, national governments, as well as civil society partners to push for a resilient and sustainable health systems and their participation in the National Plan of Action for Health Security. And all of these are actually also ensured that they're sustainable by participating also in the community-led monitoring mechanisms. So as I see now, I think before we can proceed to the next presenter, we can accommodate 1 to 2 questions.
Sure.
So please, I see Linda raising her hand. Linda, do you have a question or is it an old hand? So I'm also trying to look at the chat now if there are questions. All right, so I see Lizzie raising her hand. Go ahead, Lizzie.
Great, thank you for the presentation. Just a quick one. I know we're closing in, and the way it's Olive mentioned that it's almost been a year now. I just wanted to know, was there like a moment for you where things were actually working? Because, you know, the role of communities, especially within pandemic preparedness, has been a little bit dicey. It's never structured, or we know exactly what communities are doing. Has there been a period during that whole process where you feel like, you know, now we've said we know what communities and civil societies are doing, we know where our role is, And if we're talking about disease X and the next pandemic, at least we know how we're going to fit in the entire conversation. I was just curious about that.
Since Achieve is also implementing the national integration of CLM, so I think I see the role of the communities in this area. This is an area that we are very comfortable, and when it comes to ringing the alarm, that can be a role that the communities can do, and that's exactly what our Department of Health is also asking. Our partners are also asking if they can help. This is part of human resource for health, right? If we will be able to do it. So that I can see we can do, and that is a clear role for us, for the civil societies and communities.
All right, so I think Lizzie agrees 100% now with your response. Thank you, Shine. Another question from the chat. Olive is asking, could you share the process of including PPR indicators in the country CLM mechanisms? What are the key lessons, and what advice would you share to other country implementers who are also undergoing the same process?
So obviously we have national plans and national policies that we will anchor it on. And when we develop this CLM mechanism specifically for PPR, we also ask the community to provide the feedback on the developed one. And after that, we actually, at the end of the day, they are still the ones that we train to use the KII tools. All of they will have to answer PPR issues. So from the development, feedbacking, until the use of the tools, and as well as its integration into the roadmap, these are all the processes that our communities have been involved in. As for the lessons and advice, I think it will always be a difficult process because it's something new for the Philippines, and I think for other countries it will be also very new. For us, it was already difficult to integrate HIV and TB for CLM, and it's much harder to integrate also PPR. So it's a difficult process, but you have to push through because at the end of the day, it's important to look into health emergencies too, as we look into HIV, TB, malaria, and all the other diseases that we want to monitor.
Yeah, just to follow up on that, Shine, I think in terms of HIV and TB, CLM is quite more mature in those areas. So probably in PPR, any challenges, specific challenges that you encountered in your country?
For PPR, obviously the NAPS is new. Our last one was in 2018. There was no funding for 2025 NAPS. We're just doing the NAPS. We're on our second day now, but we're pushing for community engagement, participation in the plan, as well as including our communities in the aspects of community mobilization, HRH, among others. So it's difficult to not have an anchor on the national level. So obviously you don't want to work in silo. You will always want to have an anchor where you can base all your indicators and tools. So that was the most difficult part for us. That's the greatest challenge. And however, now that we're pushing for a better NAPS, a better plan for the country, I think it will only be difficult in this few years, and then maybe later on, if we have a plan, we'll just have to revise it. And then there's already an integrated community mobilization or community engagement in the plan. We all know the plans, that it doesn't change that much over the years. So once we put our what we want in the plan, then it's gonna be there for a long time.
Yeah, so I think it's always a process of iteration and making sure that the plans are not just plans, but also become implemented, no?
True,
So
true.
I see Rachel raising her hand, and then we might need to go to the next presentation already. Go ahead, Rachel.
Thank you very much, Shine. My question will be around the PPL training. I like your presentation so much and how you presented on everything. I just want to find out, so what are the plans in terms of reaching the other communities and CSOs for PPL trainings? Are you still having PPL trainings for communities or has that stopped? If it has stopped, what are the plans to engage the others who were not part of the trainings you've had?
You know, that's a funding problem, Rachel. So that was Rachel, right? So that's a funding problem because these are just volunteers, and we know that the volunteers will not stay long, and we always want to train them. Obviously, there's the process of producing trainers for them to train their constituencies. I mean, that's ideal, but at the end of the day, we still have to find funding to train new breed of advocates and community leaders. At we can only have champions. We train 100, we'll have 2 champions, and then some would leave the advocacy work, and that's a reality in what we're doing, but it's important, so we shouldn't stop.
Yeah, so I think you have previously demonstrated your ability to create force multipliers in your PPR and human rights training. So I think for the next set, we'll be also looking forward to the developments on that. So thank you, Shine, for the presentation of the Philippines.
You-
So now I'd like to turn over the floor to Paul to present their country's updates in terms of Nigeria. Go ahead, Paul.
Thank you very much, RJ, and thank you very much for this great opportunity. From Nigeria, we want to showcase the community participation in terms of surveillance as well as information sharing, which is very key and a gap which has been shown through our survey that we have carried out in Copper CE. And also, it is one of the key alarming issues when it comes to Nigeria at large, generally. And when we talk about community, before moving to the last slide, we know is an abstract information or an abstract words. But here we talk about the vulnerable communities of specifically when it comes to IDPs, when it comes to people living with HIV, people with tuberculosis, as well as religious leaders within those particular groups who are key, and reasons why for the vulnerable community is because during the previous pandemic, they were key in terms of having the effect of this. So in the last slide, you will see the assessment we did. If you can go to the next slide, you see why and the reasons why we need to also include them. Based on the assessment we have carried out, there is an exclusion of community voices as well as the CSOs. The assessment shows that 56.3% of those that we have interviewed have shown that they have no option for sending feedbacks during pandemic. So during disease issues, if informations are passed to them, most of the information is via radio, and they do not have a sections where they can bring or voice in their voices as well as both at the national as at the subnational level. When you look at the National Action Plan on Health Security, when you look at the JEE platforms and the IHR platforms, as well as the surveillance, the EOC at the national and subnational, there is no representation of the vulnerable community CSOs in those platforms, which is also very important because they are the ones working in the community. When it comes to equity in terms of health access, you can see a gap where 45.8% struggled to access care during the previous pandemic, and especially the NOMAD, which is one of the key vulnerable population in Nigeria, especially in the north where we are currently making the implementation. 70% of them were not vaccinated during and even after the COVID-19, which is also an alarming due to gaps, as well as gender has become an issue and human rights, where you see that there are a high number of unequal treatment by women, among women, as well as children. So this actually necessitates the need for the inclusion of this voice because, as you can see, neglecting us actually creates gaps in the surveillance as well as weakening risk communication as well as community engagement in large. So this is one of the key reasons why we also have a key issues when it comes to misinformation about what the disease is all about and the gaps in terms of communication. So inclusion, including those voices, that is the community as well as the CSOs, we actually create equity, accountability, and resilience when it comes to pandemic. That is why we see the essence and then the need to bring their voice into the decision-making platform. So in the next slide, you can see what we have started in terms of bringing the community into these platforms. So we were able to invite, in the first place, you can see capacity building and training. We invite different communities, not only those from the vulnerable, the community leaders, the traditional leaders, and including also the stakeholders, that is part of the government representative, the SEMA, and many more, to train them, and then to also make it as a point of creating linkages where they will understand the need of community and also hear the voices of community during the training as well. This has actually increases an impact from 23% to 83% during the training, which they have about pandemic preparedness. And also, aside from that, we know that there are key offices, there are key sectors that need to be advocated for in order for voices of the community to be heard on those particular programs. So that is why we now carry out advocacy activities. Those advocacies, some are physical, while others are on social media using the hashtag CENG to voice out the voices of community. On those platforms, you can see where religious leaders are voicing out their voice, youth are voicing out their voice, genders, human rights, and many more are voicing out their voices as well. So this also we carried out physically, and which also leads to key important inclusion of the CSOs as well as community at the subnational level. For example, in Gombe as well as in Adama and so many Bauchi State where we are also carrying in implementation. And you can see meeting participation because of the advocacies, because of the training, knowledge people have on those on capacity, on community engagement, necessity in pandemic preparedness, as well as epidemic issues in the country, not only pandemic. So those platforms, community, we are invited into meetings. So you can see here on the next one, that is meeting participation, you can see many people coming together. This is actually a emergency operations center where diseases, surveillance reporting are being shared so that community will also have impact or have decision making as well as carry out effective risk communication to their various community. So one of the things that you can notice also in this picture in terms of the meeting, you can see many people with photograph because it's one of its kind. It has not been happened. This is one of the kind, and that is why many people are coming to also snap picture to witness this particular activity which has taken place. And again, one of the key things which is very important, not only participating in the meeting, but also reporting in terms of diseases as well. So you can see by the participation in disease reporting, you can see this is a WhatsApp group which was snapped. This WhatsApp group was created by joining together with the state's public health department in a subnational, at the subnational level in Gombe State, where we now include the voices of the Sangaya, which is a school of informal school for training in terms of religious aspect. So we are able to advocate for this, and this has become successful. And currently, the state have taken over the platform in terms of sharing of information and going to those communities to search for more information when it comes to diseases. So currently, the platform has actually linked the community and the public health sector, not only talking about pandemic preparedness per se, but also talking about the epidemic concern that is currently in Nigeria. So measles, diphtheria, cholera, and many more are reported through this particular platform. So to make it more elaborate, in the next slide, you see after identifying the gaps that we have seen, so this is a particular case study to showcase what we have done so far in Gombe State, of which I think the public health director actually be on board also to talk about the impact of the result. But however, he was talking about network challenge, but hopefully he will join as well. So after understanding the gap, so we now lay our own personal advocacy to the state public health director. And from there, they pick an interest. Then we will now go together with the public health director to the government agency as a voice of advocacy, not only from the community aspect, but also from the government aspect in terms of the health, for the inclusion and then for the representation of the Sangaya into the surveillance activity. So the first picture here actually portrays our advocacy to the government representative, to the Honorable Governor representative of Gombe State in terms of the Sangaya schools, or those who are representing, the key person representing the Sangaya in terms of decision making in the government. So here give us an opening where from this particular angle, we now go to the community to meet the Sangaya. You can see in the next picture to mobilize them in terms of discussions and in terms of sending information to show them the pathway of sharing diseases reports that has to do with any illness in key platforms. So, and after the mobilization, we now move to orientation, where we now invite those key groups to orient them on what diseases are and what they need to do. And that is where the link was established between the community and the public health, which is also a gap. This community, Sangaya, that we're talking about, is one of the neglected and one of the key communities during the pandemic. There were a lot of issues that were discovered during pandemic in terms of high number of reported cases as well as gaps as well. So you can see the Sangaya people now end up by sending report and then being a contact in terms of communication. So that is the last picture you can see here, where it shows some of the reports they are writing and sending it on platforms, and some of the pictures they are sharing in terms of some diseases that actually is taken, that is occurring within their particular environment as well as community. These have actually created a get link, and we engaging the community, that is the religious leaders, that is their leaders in this aspect, have actually created a strong link and then trust, where anything that is being said in terms of disease, since their community leaders are there, they will be the one to carry out the information to the community. And if there is any gap, they will be the ones to now share back to the platforms, as well as call numbers to ask for key informations, and they will now say to the community. This open a way, and this is more of sustainability. The essence of why we said it's sustainable, because it has currently been taken over by the state public health. We are just staying by to see how they regulate it, and then to keep on giving advice, so that even after Copper C, it will keep on in existence. So the next slide talk about what we are doing, not only at the subnational level, but also at the national level. So currently, at the part of the next step, you can see we want to secure permanent seat for at the national PPR platform through our joint advocacy. Currently, we are working with key, like we said, we are working with key vulnerable population. So the ACOME, the Stop TB Partnership, the Unite, the TB People, the NEP1, as well as the TB Network. We are joining together for advocacy for the inclusion of key indicators into the national PPR when it comes to community and then gender specific concern, as well as also we are also advocating for the CSOs to be part and parcel of the monitoring of the nerves. So currently this activity is currently ongoing at the national level. So again, in terms of reach, we are also reaching out to showcase more in terms of our advocacies at the social media, so that it can be more of evidence-based as well. So community surveillance will be more, not only in the Sangaya model that we have shot, we have also included religious leaders, and many more. So we want it to be enacted as a policy as well that is backed up at the national, but as well as subnational. So fostering CSOs partnership and for sustainability. That is why we want to see the CSOs have a permanent seat at the PPR platforms, not only at the national, but also at the subnational. So the main goal is that the community and the CSOs as co-owners of the preparedness and response, not only people that will be invited. So you can see one of the advocacies that we have led into the highest, one of the highest policy making body in Nigeria, that is the legislative, where we now seek for the integration plan for IDPs to be inclusion nationwide, which is also a gap. So this have actually led to a lot of success, and currently is part of one of the key instruction that is given for all states to be including the consideration of IDPs into their annual working plan whenever they are carrying out activities. Thank you very much. And over from my own end. So I'll pause here and attend to so many questions as well as clarification. So hopefully trying to see if the director is on the call, so that already he thought that he is facing a kind of a network challenge. Thank you.
All right, so may we know if the public health director is on the call? If he can unmute. Sure.
Dr. Billy, if you are on the call, please kindly only mute and give us more on the impact of those results in terms of updates as well.
All right, I think while we're still waiting for Dr. Ebeli, I think one phrase that would describe Paul's presentation was the transition from exclusion to participation. So in his in the story of Nigeria, it was very evident that the CSOs and the communities are actually active agents in terms of participation in policy and planning processes of the national government. And we also saw that they also participated in terms of creating their own model for disease reporting. And it was actually a platform that can be utilized by different diseases, no? Infectious diseases. So I think that's very interesting. And one interesting point also that Paul shared is how they got the buy-in of the religious groups as well as the government stakeholders before rolling out all of these processes. So maybe Paul, while we're still waiting for the public health director, you can share the possible rationale on why you started with getting the buy-in first of the government stakeholders before forming the coalition.
Thank you very much. Before forming the coalition, we understand that the government actually have, they are the key in terms of decision making. And one of the key reasons why we involve them is to show them those gaps and the need for the inclusion, as well as working on those gaps. So in Nigeria, one of the key things is evidence. If you are able to show evidence and then necessity, so the buy-in would not be a major issue of concern. So in that regard, we have already set up the mind of the government to show them that the community are lacking behind, and nothing has been done again since from the previous pandemic. So we are coming. So without you informing the government in Nigeria, even if you come sometime, it will be a great difficulty to assess them. So we share information with them and then make sure they actually give us an hearing. Then we come in large number to showcase why and the necessity for the inclusion. Thank you.
All right. Thank you, Paul. And probably somewhat related to that, Olive says in the chat that well done to Team Nigeria. She's also curious on how you maintain the relationships through the Copper CE, because I think it's really one of the key things to sustain the efforts, right? To make sure that the group is intact. So what are the key lessons that you've learned from this engagement?
Thank you very much, RJ. I think we have a lot of lessons. one of the key lessons is that we thought that the government will not give us hearing, listening ear. They will not attend to us. They will tell us that they are too bureaucratic and everything. So, but the reverse is the case, actually. So while we are contacting the community, especially some of the CSOs in this advocacy, there is a key challenge. One of the challenge is the aspect of what is in for me. We are specific on this issue. Why are you bringing this issue to us? What is in for us? So getting their attention on this has become one of the key challenge. So we have to revise and tell them that whatever you're doing, so if there is pandemic, it will stop your activity. So there is need to come together and then fight this aspect. And this is for the sustainability, not only for our own sake. So this we are able to convince most of them, and then this was actually lead to a lot of success as well. Thank you. And many more engaging the multinational organizations is also a key challenge, where you send a lot of mails, but fortunately to us, most of them has respondents. We have to now align what we are doing with some of their key indicators to show them the necessary and then the essence of coming together because of that indicators as well. Thank you.
All right, very insightful points from Paul. And there's this question in the chat. Paul, how do we sustain great work after the end of the project?
Yeah, thank you very much. One of the key reasons or ways of sustainability is to bring the CSOs into the pandemic platform, is to bring the community into the pandemic platform. What we mean by the pandemic platform is there. It cannot end. But if there is no CSOs on it, then there is a gap. So we want to secure a permanent seat for those CSOs on that platform, so that when issues are being discussed, they will be there, asking informations, having more information, sharing it to the community. So you can see this is more of a great sustainability where they are already on the platform. So this is one key, not only being on the platform, but also have a say, a percentage of saying in the platform. So this is one of the key strategies we are planning, and it's already working. In subnational level in Adamawa State, for example, you can see we have the ACOME, that is the regional ACOME. We also have the TB Network regional. We also have the Nepal regional on those platforms currently. So it's working. And we also have the religious leaders on those platforms. It's also working. So in terms of sharing information, in terms of designing the information, not more of sharing the information, we can share some of those designs that was carried out together with the religious leaders and then the community, which was very impactful. And they were gladly taking it because they partake in sharing as well as developing the information. So this is a pathway of sustainability. Thank you.
All right, so different points in terms of CSO entry in engaging the government. So very interesting.
Yeah.
So before we proceed to the next presentation, I'd like to call Mohammed if he has a question. Go ahead, Mohammed.
Yeah, thank you very much to the two presenters. I think my question is almost similar to the one Paul have already responded to. But this is for the general body, more so to the Global Fund. We know and also aware that countries have made so many strides and also significant gains into this PPR response. My question is, how can this be sustained going forward when we are talking about limited resources? And most of these gains that we have made, the people that are really pushing these gains are volunteers. So they need resources at the end of the day to make sure these gains are sustained. So how can we sustain this going forward at the end of the day?
Maybe to respond to this, I'll respond to it in two critical case studies. One regarding the JBV and two again regarding with the community. So on this platform that we created is a platform of sharing information and discussion. So this platform will bring people, not you being physical sometime, but you being on the chat, you see information and discuss from the national level as well as from the subnational. Then you pass out this information to the community. Now, currently, in Nigeria, we have what we call the CHIPS agents. That is the community health influencers, promoters, services. And we also have a particular initiative called the Mama to Mama, who are under the PHC at the community level. So when it comes to JBV, we understand during the past pandemic, there are issues related to this. So engaging them is currently ongoing, where we will now pilot to see how they will continue sharing information as well as cards with regards to issues on JBV, and then using the same health structure in an integrated way, where the EOC phone numbers will be used to be shared issues related to JBV, and the JBV also have a desk on the EOC to be receiving information about gender issues, which will create a cross-cutting and then key relationship in terms of disease, in terms of JBV, in terms of reporting pathway, in terms of referral as much as it can. Thank you very much.
All right. Thank you, Paul, and excellent work to Team Nigeria for your presentation. All right, so we'll be moving on to the last presenter, but definitely not the least for this session. So I'd like to call our representative from Liberia, Leo, who will be presenting us to us their work in Liberia. Let me just share screen. Okay, over to you, Leo.
Hi. Hello, are you getting me now?
Yes, we can hear you.
Okay, thank you so much. So my name is Leo Itia from Liberia. I'm the Executive Director, Youth Network for Positive Change, UNEDPO. We are the implementer for Copper CE project in Liberia. And we are supported technically by At Africa as one of the technical partners. So please go to the next slide. Sorry, right now we are having one of our activities, so I have to step out of the event just to ensure that I participate in this training, this webinar rather. So basically, as we all know, Copper CE has been a project where we have been implementing since July of last year, and some of the key activities that we have received so far, or the achievement we have achieved as part of the implementation of this project in Liberia. One of the first, we look at the PPR multi-stakeholder coalition. So there has not been any of such coalition in Liberia as it relates to PPR, especially a multi-stakeholder one that comprises of CSO communities and even the government agencies. So because of this project, as part of our activities, we've been able to establish this multi-stakeholder coalition to be able to participate in various PPR platforms. So as part of this also, we were able to do some PPR training. So for example, we trained 80 representatives of CSOs and communities, and basically it was focused on understanding the different processes and mechanisms as it relates to pandemic preparedness and response. Because initially, the project, when we started, CSOs and community had no idea on these processes, system, on how Liberia, for example, deal with pandemic and what are the different platforms that they had in place. CSO had no knowledge. So because of this training now, CSO also start to understand the JEs, the SPAs, and the NAPs, try to understand their purpose and how they are conducted. So through this training, there has been increased knowledge among CSOs. And we did a pre-survey before the training and then a post-survey after the training. So we saw a high % increase in the knowledge in terms of people understanding about the various processes within pandemic preparedness and response. And then also looking at the national PPR platforms that are existing for them to have a knowledge. The next thing we're able to do, based on the gap in terms of civil society and community representation in these pandemic preparedness platforms nationally and locally. So we decided to develop our PPR advocacy agenda as part of the project activity. And that PPR advocacy agenda lay out our clear priorities in terms of what we want to see for community, in terms of how we want to be involved, with the various processes at local and national level as it relates to PPR. As we all know, when there is a pandemic or epidemic, the most marginalized people are the ones who get affected: community dwellers, civil society, and so many others. And civil society are the frontliners during these various processes, especially for a country like Liberia, where we have experienced Ebola, COVID-19, and currently Mpox. So, and learning from Ebola, especially, civil society play a major role in ensuring that this information and following the necessary SOE laws in Liberia, for example, civil society was the one on the front line. So given that importance and the role they play, through this advocacy agenda, we advocated to ensure that civil society have a seat at the table, not only during the response, but also during the planning preparation processes for pandemic preparedness and response in Liberia. Next slide. And also we publicize this agenda to be able to spark public debate and get support from communities through radio talk shows, town hall meetings, to ensure that a lot of citizens have knowledge on the processes and the agenda that we try to advocate for as per the National PPR Advocacy Agenda. No, sorry, back, please. The previous one. Okay, the next. Okay. So also, because of this advocacy agenda now, the various platforms that we had in place, for example, the National EOC Center at the county level in Liberia, we have 15 counties. So through the Ministry of Health, there are 15 county EOC centers at the county level that is being supervised by what we call the county health teams. So we also have the technical working group at the NAC, which is the National AIDS Commission. We also have another technical working group at the National Public Health Institute. And we also have a working group at the Ministry of Health that also coordinate the One Health platform. So because of our advocacy and engaging with these stakeholders, and our approach was to ensure that they are part of our multi-stakeholder platform. So when they are part of the multi-stakeholder PPR platform, obviously they understand our issue, they can be able to advocate and champion CSOs voices at the level of the various platform. So because of that, there was enrollment of CSO. First, they started as observers to just go and observe in the meetings, but now because of the level of relationship we have built over the years through the implementation of this project, now CSO are participating in a meeting, not just an observer now, but they are participating. They are even being put on subcommittees. Take, for example, in a One Health governance manual, now we have civil society having a clear role in that manual on how, because the One Health manual is the general PPR policy document that guide the country and that is being supervised by the Office of the Vice President. So in that manual, civil society participated in the review, they participated in the validation, and they participated in the launch of the manual. So now CSO have a seat at the table, clearly outlined in the policy document. Also, we, through this TA, we also have, through this project rather, we also had a lot of TAs that came in from different segments to be able to support the project objective. So one of the TAs that we received firstly was focused on reviewing CSO involvement in Liberia's JEs, the SPAS and the NAPS, and also looking at the MPOS plan. And that TA was successful, and it was through that TA that we even participated in the NAPS, and then also the development of the revised NAP for Liberia, and then also the One Health governance manual that I spoke of earlier on. We also have another TA that focuses on primary health care, looking at the various challenges and the governance of primary health care and how communities and civil society are also involved. Remember, COPA is about community voices and participation in PPR and national health decision making. So because of that, we developed a policy brief, and that policy brief was geared towards proposing alternative financing for health, and basically looking at pandemic, not waiting for epidemic to emerge before government start to look for resources. There should be a set aside resources that should be available to respond immediately, and not only for response, but to also strengthen the various mechanisms that are in place in terms of preparedness to ensure that Liberia's position is clear, learning from Ebola, learning from COVID-19, and now mpox. So that policy brief, we had a dialogue, and then we had the host, because in Liberia, we have a bicameral legislature, the host in the Senate. So we had a host committee chair, Honorable Judy Fatoma Roy, who attended that policy brief, and we had the Assistant Minister of Health for Policy and Planning, who attended that meeting, and they committed to ensuring that they will advocate on the floor at the time the host was not in session. So once they resume session, they want to advocate on the floor to ensure that there is a set aside funding in the national budget for FY26, because Liberia is now in the current budget year, FY26, to ensure that set aside funding is there for pandemic preparedness and response. And also the Ministry of Health also committed to take on the advocacy that we have put before them through the policy brief to be able to engage with all other stakeholders, including the Senate, because I said we have a bicameral legislature, the Senate, to also concur with the House to ensure that we have funding for PPR in the next fiscal budget year. And also, we also currently have another policy brief that is being developed, that the policy brief around primary healthcare, like I said, looking at CSO participation also. Now the Ministry of Health have realized that communities, even though there is a national primary healthcare policy, but what is being highlighted in those policies are not being implemented locally. So the ministry now, because of the second policy brief that focuses on primary healthcare, is now focusing its intervention to ensure that communities, civil society are heavily involved at the community level when it comes to primary healthcare, because this is the first responder in the healthcare system. And the communities who are the recipients should be the participant within decision-making at the primary healthcare level, as it has been highlighted in the primary healthcare policy. So these are some policy brief and some achievement from the policy brief that were developed. Also, like I said, the policy makers already committed, for financing. Next slide, please. Yeah, so I already talked about the primary healthcare policy, where we did KR, we had consultative meeting with CSO and civil society to ensure that we're not just developing a policy brief that, from our perspective, from the desk review, but they are also involved. We have their voices. We share with them for review. They give their input, and then we finalize before we can engage a policy maker. So they are involved at all levels of the intervention and within the implementation of the Copper CE project in Liberia. So we also, like I said, we have received 3 technical assistants. We have one running right now that is looking at the policy brief that was developed, following up on the commitment that was made, and also mobilizing community voices to also advocate with their constituents or representatives to be able to ensure that the commitment that was made during the dialogue is being implemented, and not just getting the commitment, but we should also follow up to ensure that they have the will to be able to live up to those commitments. Next slide. So these are just photo shots from some of our engagement. The first photo there is the engagement. Like I said, the host chairperson in one of the policy dialogue, Honorable Judy Fatima Rare. She's a chairperson on the host committee on health. So she is in one of our meetings. She's at national level. And also we have Honorable George Pega, Assistant Minister for Policy and Planning, that I spoke of earlier, attending one of our events. And also we have Dr. Joelle Tapet, who is the Moswaro County Health Officer. So she supervises the EOC centers at the county health team in Moswaro. And the same structure is in other counties. Next slide. Yes, so I will stop here for any question, comment.
All right. Thank you, Leo, for the presentation of Liberia. And I think the phrase that would describe Liberia's work is really from policy briefs to concrete commitments from the Senate and even the Ministry of Health, as well as the Congress persons, and even to the county health officers. And I think I'm also interested to know how when you were developing the policy brief, what were the specific agenda items identified by the civil society? And because of your advocacy as well as the lobbying to the different policy stakeholders, what were the specific commitments that were won because of the policy brief? Maybe you can speak more about that.
Yeah, so CSOs and communities were basically concerned about financing for pandemic, because given Liberia's experience with Ebola that impacted the country on a vast scale, coming again to COVID-19, there has not been any set aside funding available. So what CSO were recommending, for example, have an alternative funding where, for example, in Liberia here, we have the National Road Fund, where every gasoline that is being imported to Liberia has a cost on it for financing roads. So similar approach can be used to help to have a set aside funding to be able to cater to pandemics, not only when the emergency come out, but before even they can come out, to be able to train health workers, to be able to train communities, to be able to create a platform for easy accessing of information, to be able to tackle disinformation just in case of emergency. So these were some of the concerns from CSO. Also coming to policymaker, like I said, the policymaker agree that what came out in the policy brief is clear, it is true. So now they are taking back to their Congress to ensure that they be able to discuss and lobby with their colleagues that there is a need to set aside funding in their budget annually for pandemic. Not only to wait when a epidemic emerge, but before even then to be able to strengthen the systems that are in place. So those were some of the commitment. And then the Ministry of Health, who's championing the intervention in Liberia for health, also agree in that they're going to take responsibility to ensure to advocate further with the commitment that has been made to make sure that it's actually it comes to a reality. It's not just a statement, but it is actually coming to a reality. Over to you.
Thank you, Leo. Yeah, and what I'm hearing from you is that the CSOs are pushing for a more proactive mechanism for financing, as well as financing to strengthen preparedness efforts. All right, so thank you.
Yes.
Any questions? Olive, go ahead.
Yeah, thank you so much, Leo and RJ. I just wanted to ask, and probably maybe this may extend beyond Leo, even in terms of Shine and Paul as well. I'm just thinking that, we started off where we said from inclusion to inclusion. Now communities are part of the country level PPR processes, but we also know that and understand that the same because we work in the HTM, HIV, TB, and malaria communities, that we are all looking at finance, and we know that funding is a bit of a key issue, especially as we move forward. How are we therefore utilizing this opportunity of being HTM within the HTM community, and we know the response and the funding, that this also links up with the PPR, funding architecture, where we see that there's not really a lot of funding into PPR, but what can be done such that wherever there is a pocket of funding, that countries, communities, civil society, government see this as an opportunity to invest in both health systems that are agile and that are capable when pandemics come, so that we are not saying funding for PPR and funding for health. It's a big question, yeah. And probably not to Leo alone.
Yes, and Olive, I do agree with you. Like we are saying, like in the case of Liberia, the One Health approach that is not only focusing on pandemic as a whole, but entire health sector. Yeah. So how can everyone get involved to ensure that, for example, we tackle HIV, we tackle TB, malaria, and other major health, issues that or health events that occur within the country. So I agree with you. It's not about just one, sector, but be able to come up with a holistic recommendation that also tackle other issues. Yeah. So in Liberia here, for example, when the USAID court came in, the government, after we engaged not only UNEDPO but other civil society organizations that were, for example, implementing for PEPFAR and the Global Fund, looking at the court, we were able to also engage with the government and we had a high-level meeting with the president. One of our members, Libnet Plus, have a high-level meeting that represented us in the meeting, and the president committed to be able to support the National AIDS Commission. And that commitment was actually realized within 3 weeks after the president committed. We saw there were logistics delivered to the National AIDS Commission. There was additional funding given to them for an emergency situation given the court in USAID support. So I think I do agree with you that to have a more impactful drive for the health intervention or health as a whole should focus holistically tackling all of the different issues, not just focusing on pandemic. Because, for example, we can achieve on pandemic. Again, we come and say we want HIV. You'll be, these are policy makers. They'll be like, the last time you said pandemic, we push and we help, the intervention. Now you're coming with another issue. Why can't it be, a holistic approach where we can just address them all at once? So I do agree with you.
So I think here framing is very important, making sure that when we campaign for a certain policy or a specific program, it's linked to the other health systems strengthening efforts. Right. So thank you, Leo. Rachel here also says that we need to advocate for more domestic funding. I think that's one of the goals also that you set when you talked about the policy brief on PPR financing, right?
Yeah.
Okay. Any more questions for Leo? All right. So if none, I'd like to call back our speakers if there are other questions to our country implementers. So I'd like to call back Ms. Shine Catedral and Mr. Paul Balogun to join us in the panel, just in case that there are questions from our audience. Right. So we're still waiting for Paul to join us in the flow. But probably because earlier when we were talking about the successes of your countries and your efforts, it was very much focused on the positive thing. So I think for our country implementers, it's also important to learn what are the things to avoid and what are the failures that we're trying to mitigate or challenges that we're trying to mitigate. So maybe if you can mention some things not to do, would you have any inputs on that? Leo, Shine, or Paul, if he's back.
So from our experience, when you are engaging with policymakers like we did, it is important to get involved at every level. Don't just go and isolate yourself. Create what you want to create and then bring them to the table. That way, you find it difficult to get results. From our experience, say for example, most of what we're developing a policy brief, we had a technical team from the Ministry of Health that were present doing the reviews of the draft policy brief. They gave their inputs, so that way they are on the journey to help us advocate for that. And then, because once you don't involve them, they feel isolated. And already civil society, for example, most often they are looking at they are taking to be opposition. So once you don't involve and include them, I think you won't get the support you want to get from them. Yeah. So I think that's the done. Make sure to involve them at every levels. Yeah.
Okay.
For Yeah, so for the Philippines, I think what implementers should not do is to just work in silo or to just think of themselves when it comes to this whole arena of One Health, because um it's difficult if you only have one agenda. And we are all for integration now. We are all for looking into a more uh a limited financing for health, and that is exactly the reason why we are integrating the things that can be integrated. So um it is true that it will be difficult to not think of your specific community, to not think of your specific issue, like just HIV, just TB. But at the end of the day, if you work with other similar illnesses and their causes and these issues, you can, you're bigger together, you're stronger together. And if you have one aim of advocating for One Health, for ensuring that the health services during health emergencies are not interrupted, then I think that's the best way to do it, to work hand in hand with other actors.
All right. Thank you, Shine. I see Paul is able to join us already. Paul, would you like to um, give an input to the question? What should
Yeah,
country
thank you very much.
implementers?
Just a little bit difficulty in the network, but I'm fully back now. Thank you.
All right. Go ahead, Paul. Do you have an answer to the question? What should country implementers not do? Okay, I think Paul is still having some challenges with the internet connection. But jumping off from what Shine said earlier, that there might be competing priorities, right? And since the interest in terms of the COVID-19 pandemic has somehow waned compared to the previous years, how do we make sure that it's still one of the top agenda? Like when we talk about PPR, how do we make sure that it still has traction in your country? Anyone?
You know, just like any other issue, making sure that your agenda is put in the top three priorities. It requires advocacy, it requires constant awareness, sensitization, and a lot of follow-ups and dialogues with the decision makers, stakeholders, among others. So, um, yes, to remind them how important your cause is, to remind them the effects of what happened before. It should never happen again. What can we do to prevent it? What can we do to protect ourselves from the future, that they say that that health emergencies is something that we cannot stop. It will happen someday soon, sooner or later. So that's one thing. It's not making people scared, but it's just the truth.
So constant sensitization to the topic, right? Leo, would you like to share, or even Paul? Hopefully,
I
Paul
didn't,
is
I
back
didn't,
with
I
us
didn't
now.
get, I didn't get the end of the question. So can you
Okay,
repeat?
so the question is, how do we maintain the PPR as an advocacy, as one of the top priorities of the government?
Yes, so I think from our experience is that working with using a multi-stakeholder approach is important because take for example, we work also with the National Disaster Management Agency. We work with the Ministry of Health, the National Public Health Institute. So using that multi-stakeholder approach help really, because the voices will be coming from every angle of the government or stakeholder platform. And even some international organization, take for example, like Plan, who is implementing here, we also included in most of the engagements. So also that way, there's a louder voice, because in advocacy, one person cannot really lead and really make an impact when you don't have, the support from others. So I think from our experience, getting using a multi-stakeholder approach is something that will make a difference in showing that the government can prioritize. Yeah.
All right. Thank you, Leo.
Yeah,
Paul?
Yeah, thank you very much. Just to add up, from Nigerian aspect, we are also using the approach of the multi-sectoral aspect, but also we have another unique aspect, which is called the community champions. So in the community champions, these are a group of people, not only those who are in the community, we targeted people from different organizations, different settings, even some are from the government aspect. So they are the people to try to help us in pushing the PPR agendas, pushing PPR advocacies. You can see in Nigeria, and for you to reach up to the House of Assembly is a great task. So one of the key strategy we did was to now engage a representative member representing one of our places that we're working as a community champion. So that's have actually paved the way and leads to the inclusions as well as the voices of people there. Not only that, in so many activities as well. So we also make sure that those are included. Importantly, again, in the AOP of the State Ministry of Health regionally. So what we did is also in some of those health sectors, we have a champion. So whenever AOP is developed, some key informations and key activities that need to be included are included already in those aspects. So this, the championship aspect is also one of the key unique in terms of sustainability for us. Thank you.
All right. Thank you, Paul. Any questions from our participants to our speakers? So I think in the chat, there's a concern on or a question if there are committees and CSOs managing and reporting the health emergency in Darfur using the same model of communities. Peter, would you like to share this live so that you can add more context? Or maybe it's a question to the group. So probably anyone who has a response to Peter's question, you may reply via chat or you can also unmute. Any other question?
Yeah, my question was that we during the trainings, our previous trainings and other trainings, we are given a template for reporting health emergencies and how at community level. And we expect that there should be a platform where we always report on a regular basis to see how the progression. But in my place, I don't see that form being used, we don't know where to take that from either, because we have MPOX now in my part of the country, and we thought we would have a way of reporting, updating the health system on the progress and emerging issues. Now, so it is the community that have to discover health emergencies first, because they are affected first before it comes to the notice of the public. I don't see that one happening from my end where I live, and that's what I learned in this platform.
All right. Thank you, Peter, for adding more context to your question. I think it's always important to understand when there are templates provided, how data is actually gathered and then later on consolidated so that can be used to push for a specific action or a specific policy change. So anyone who has insights with regard to Peter's question, just to also ask Peter, which country are you from? Just to make sure that...
I'm in Kenya. I'm in one of the counties of the 47 counties in Kenya.
All
and
right,
I'm along the highway where the MPOX is really prominent before it gets inland.
Yeah. Okay. Maybe our colleagues from ACT Africa can give or Paul is familiar. maybe Rachel or our colleagues from the Global Fund can.
I'm not
Yeah,
sure I understand.
Yes, can I come in,
good afternoon.
RJ?
Yeah, go ahead.
Can I
This is Olive. Okay, can we take this conversation with Peter, Rachel, and the Kenya civil society separate so that we have this discussion? Because I think probably there's more to it than what Peter has put it here. So maybe we could have a discussion. And also just trying to understand that for this project, what I would also want to add is there was limited resources and limited amount of engagement. And basically it was more of like an initiative, like a pilot. But in most cases, when there are big issues like this, I think the right place to take this will be the CCM, the civil society task force, like in Kenya, as an example. But let us, with Rachel, Joanne, and Peter, I would love to have a side conversation. Thank you.
All right. Thank you, Olive, for walking us through the process and also directing.
Thank you very much. I can see your questions on the chat, bro, regarding advocacy for more domestic funding. I don't know if I can respond to this as well.
The conversation. Thank you, Shine, Leo, and Paul for joining us in the panel. Discussion and also presenting your be loading anytime now. All right.
Thank you. Thank you.
Thank you so much.
So we present
Thank you.
certificate.
Thank you so much. Oh, wow.
Wow, thank you.
Thank you.
Another one to Paul
That's
Balagun.
nice.
Wow. Thank you.
Thank you, Paul. And then also Leo Atia
Thank
from
you.
Liberia.
Thank you. That's nice.
So thank you for sharing your insights. And before we proceed to the next part, I'd like to also take this moment if we can have a quick photo with our participants. So if you're comfortable, please turn on your camera so that we can take a quick snapshot of our participants. Right. Jeff, can you take the photo?
Yeah, sure. Thanks, RJ. So let me just wait for everyone to open their camera. All right, I'm doing the first panel now. Put on your best smile. Look at the camera. 1, 2, 3. Okay, sorry. Can I just... Okay, I'll do the first panel again. 1, 2, 3. Okay, I'll do the second panel.
All
1,
right, please see everyone.
1, 2, 3. All right, there you are. Thank you so much, everyone.
Thanks and bye.
Have a great day. Bye-bye.
Thank you and bye.
Thank you.
Thank you for all and bye-bye
Right,
to
and
everyone. Thanks.
to end, I'd like to
Thank
also
you.
share.
Bye-bye.
Don't forget to answer the evaluation form that you can see on the screen. Unfortunately, we're losing RJ, but that's okay. So just please scan the QR code, or I will just put the link to the chat box.
And please also follow our social media channels on Facebook, Instagram, Twitter, and Facebook.
Thank you to our interpreters as usual. Thank you, Some. Thank you, Indy. Thank you, Bongkong. See you next week.
So we'll also be sharing the recording once it's up.
Yeah.
So maybe in the next few days we can upload it on YouTube.
Yes.
Yeah, thank you very much. We appreciate that one. If you share.
We'll close this in a few minutes, so just make sure you already have the link to the evaluation form. We highly appreciate your comments.